NYAM's goal is to advance the health of people in cities, and we know that well over half the world's population live in cities, so anything we do here in a city like New York is going to have national implications and global implications, and we're excited to be working very actively at all three levels. So we really want to commit ourselves as an organization to take on a real close examination of how we can bring the unique resources of NYAM's research and community engagement and education and convening power to the many groups in the city. And we've identified sort of three overarching areas for our work over the next year. The first is the issue of aging and healthy aging as a paradigm shift. The second is the issue of health disparities and vulnerable populations. And then the third overriding area is public health. Our original work on aging began with the Social Work Leadership Institute, looking at a national reform of social work education to create a practicum experience for students that were going to apply their master's education to working with older populations.
Right now we're trying to assess the current level of age friendliness of the city using the World Health Organization criteria. And the criteria that WHO has laid out cover a range of domains, everything from outdoor spaces and transportation and buildings and housing and civic engagement and social participation and respect and information and health and social services.
It's not about healthcare primarily, it's really about how do we create an environment in which people can stay active and enjoy a high quality of life for as long as possible. We've been working very effectively with the City Council and with the Mayor's Office. They've been helping us with what we've called a public consultation process. It's involved a series of expert roundtables where the best thinkers on issues like transportation, housing, social services, the business community, healthcare community have been brought in to sort of see what they're doing on the issue of aging and working with older people and what they think they could do if they had better incentives, better supports.
Our seniors don't just want lunch and bingo. Our senior centers want job retraining, resume writing, they want wellness programs, technology.
Right. And if you have other ideas, I think they'd welcome them being
always
fed
open,
in.
yeah. We've been conducting a series of public hearings, and the focus for that has been hearing the voices of older people and their caregivers, and they have not been shy.
What I would like for somebody to do is come in and say, we're building a central location for senior citizens to have a liaison between all these other agencies that are not addressing what we need.
Everybody listened, and they were willing to take suggestions how to make it better. I was impressed with that.
We know cities are complex places. There are very special problems that affect certain populations more than others. Populations suffering from mental illness, populations dealing with substance abuse, issues of returning prisoners and making sure that they have health care coverage and they reintegrate into their communities more effectively. The other aspect of our work that has global implications has been the work we've done for many, many years on HIV/AIDS.
Most of the new epidemics around the world in HIV infection are related to injection drug users. The information that these countries are getting about how to stop the epidemic comes from the work that we've been doing here.
A syringe access program is a program that was started by the state a couple of years back to make access of syringes to needle users, drug users, so that they do not have to share needles. Just one only. We've been close partners with New York Academy of Medicine because I've taken all my technicians there for training so that they know what to say when the customers come in to buy the syringes. And then anything that the customers have asked us of, we always pass the information to them and then they provide us with the answers. I believe I'm helping the community a lot because we have less needles scattered on the streets. You see less people trying to reuse a syringe. At least one thing we can do, try to, if whoever already has a disease, don't spread it to somebody else. That's the least we can do.
With our research, with our community engagement, with our library resources, we have a special role to play in supporting the work of the city and state health departments who really are in the communities providing the backbone for what must be an engagement of communities and academics and the business community and media in dealing with real health problems at the community level. Our school health program has been working in this area for over 25 years and really made a major contribution to the public schools in New York City.
Over 2.5 million students have been affected by our programs, 1,500 schools, and 15,000 teachers.
The Junior Fellows Program is a program where we motivate middle and high school students to pursue careers in health professions.
Kids are pursuing a course of 10 sessions where they get to meet with some senior scientists, some of my colleagues who are world-class physicians and health professionals. They're getting study skills, they're getting research skills, they're having mentors from our fellowship, and they're having field trips to local academic medical centers.
We think that if a woman with HIV wants to have a baby, they should consult a physician before making a decision.
I never knew there are so many diseases out there, and there are so many things you can do to help people around your neighborhood.
Junior Fellows program is really prestigious, and it was an honor being in it.
Our students reflect the demographics of the New York City public school system. We focus on underrepresented minorities and women. We have African American and Latino students, Asian students, West Indian students, students from all over the globe.
The country I'm from originally is Algeria. I want to benefit the people that I know there, my family and my friends, and make Algeria better.
We have a terrific staff, but none of this would be possible without the enormous help and support of our trustees, of our fellows, of public officials who've taken an interest in our work, of foundations who provided such important support, and of the donors without whom we really could not make the difference we can make in the health of people living in cities.